Hi, and welcome to the Muslim Sex Podcast. This is Dr. Sadaf Lodi, and I would love for you to leave me a review of this podcast and also to share and like it and share it with your friends, see what they think, and let me know. I would love to shout you out on social media. And also, I would love for you to follow me on Instagram at Dr. Sadaf OBGYN, as well as TikTok. I also have started a YouTube channel at Dr. Sadaf Intimacy Coach. I'd love for you to follow me on all of those channels. And most importantly, I'd love for you to become a patient. I am now accepting telehealth patients for sexual health as well as menopause health in New York and Michigan. So if you are a woman that is looking for a doctor that understands you and can actually take the time to listen to all of your concerns, reach out to me. Reach out at Dr. Sadaf at drsadaf.com. And I would love to see you as a patient. And now for the episode. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about intimacy and cancer. Before I get into it, the first thing I want to make very clear is that I'm not giving any type of medical advice. So if you're having any issues or concerns, please see your healthcare provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that speaks about sex. So today I have on with me a very special guest, Dr. Julie Monroe. And Dr. Monroe comes to us from New York. And Dr. Monroe, I'm so happy to have you here today. And I'd love for you to introduce yourself to our audience.
Thanks. I'm happy to be here. So my name is Julie Monroe. I am a board certified medical oncologist. I went to Cornell Medical School. I trained in the New York City area at New York Presbyterian Hospital and Memorial Sloan Kettering Cancer Center. And I practiced general medical oncology for over 20 years in Westchester County and Greenwich, Connecticut, which are the northern suburbs of New York City. I had a very busy, thriving practice. I was the chief of the Department of Hematology and Oncology at my hospital. I had a reputation for specializing in women's oncology, so much of my practice was breast cancer and gynecologic cancers, although I treated all types of cancer. And what I found in my 20 plus years in practice was that there were changes in healthcare that made it more and more challenging for me to give my patients and their families the time and attention I thought they really needed and deserved. At the same time, I had family members who were diagnosed with cancer. My father had prostate cancer, my mother in law had bladder cancer, and my younger sister was diagnosed with breast cancer at a young age. And I kind of had to jump in and quarterback the whole process for these family members, make sure they got to the right doctors, understood what was happening, their diagnosis, their treatment options, and were able to weigh the pros and cons of everything. And, my sister said to me at the end of the whole process, "Oh my gosh, how does someone go through this who doesn't have a sister who's an oncologist?" And I realized there was a real need out there for extra support for people dealing with a cancer diagnosis. So I ended up, it was a difficult decision, but about 6 years ago, I left my full time oncology practice and I started my current consulting practice that I do now. It's called Cancer Consulting Services. And basically, I provide concierge extra support and second opinions for people dealing with cancer. Um, and I found this process to be very satisfying for myself, but also for the patients and the families that I work with. Um, it's kind of a new thing that I'm doing. There aren't many oncologists out there providing this kind of support, uh, but I think there's a real need for it.
Absolutely. I mean, I know that, a lot of times when patients get the first and foremost, get the diagnosis, right? That in itself is very jolting and upsetting. And just to process that information on its own, then let alone trying to navigate the healthcare system where both you and I know is very complicated. And it ends up being really, unfortunately, a lot of connections, right? And being able to get services, especially with cancer, when you need those timely services, it really makes a huge difference if you have connections or if you know somebody that can get you in sooner than, say, you trying to make an appointment on your own, right? I mean, it really does make a huge difference, unfortunately, but that's really kind of the way it is. And so, yeah, what were you going to say?
Well, I was just going to say, what happened again, like we started out as a private practice and you called the office, you got my secretary at the front desk, and the call went right through to me. And there, all these barriers came into place where patients could no longer call the office. It went to a call center, which was in North Carolina, hundreds of
Mm,
miles away.
yeah,
Or the patients were told, email the doctor through the patient portal. And, that could take hours before anyone saw that message. So my patients have my cell phone. They know how to get me at any time. They text me, they call me, they email me, and I try to reduce those barriers so that they can, get in touch. They still have their primary medical oncologist that treats them, but I'm
right.
just there to be that extra support.
Yeah, and I can see how that would be so valuable. I mean, just to be able to have another second opinion, right at your fingertips, and also be able to discuss the diagnosis and any questions and concerns. I mean, I think that's huge. So that's amazing that you offer that service. So I know you did mention the types of cancers that you saw when you were in practice, but you said you also focused on female gynecology, specifically on some type of female cancers. What cancers were those?
Well, I treated all types of cancer, but
Right.
I developed a reputation for specializing in women's cancers. So, breast cancer, ovarian cancer, cervical cancer, um, uterine cancer.
Right. Right. Okay. So that's really good to know and really important information. I'm just wondering if you have some tips regarding a cancer diagnosis. For example, like what should a person do once they get that diagnosis? What should they do? How can they get help? And who should they turn to when they get a diagnosis such as that?
Well, I think they should make sure they really understand what's going on.
Hmm.
Um, a lot of times the answers are not necessarily readily available. As soon as you get that diagnosis, that may just be a biopsy. And then there's more steps that need to be taken to figure out how advanced is this cancer? Is it localized to one area of the body? Has it started to spread maybe to the surrounding lymph nodes, or has it even spread to other organs? So, you know, find out what kind of testing needs to be done to get all those answers. And unfortunately, sometimes it takes a little patience because people want answers right away.
Right.
And we have to get all the information. The other thing I would say now is that what we've learned about cancers is that not all cancers are the same. So just because you have lung cancer, we now learn there's many different types of lung cancer.
Hmm.
And we have what's called biomarkers, which are different characteristics of the cancer that are going to help us know what's the best way to treat that cancer. Is it going to be with surgery? Is it going to be with immunotherapy or targeted therapy? And again, these tests to get these answers sometimes take time. So you may not have all the answers right away when you first get your cancer diagnosis. You be patient, make sure a full genetic analysis has been done on the tumor so that you know the right way to proceed with the treatment.
Sure, sure. So, I'm what we talk about a lot on this podcast are relationships and intimacy, and of course, cancer definitely impacts intimacy and relationships. And I'm sure you've probably seen that in your practice as well. What would you say is a common type of cancer? Something that comes to mind to me right away is, for example, prostate cancer, right? And the inability for somebody that may have had their prostate removed to have penile vaginal intercourse, or to experience that type of intimacy. What would you say are the certain types of cancers that you see, and how does it usually affect intimacy?
Oh gosh,
I know, right? That's a
right,
big
cancer
that's a
I
big
mean,
topic.
there's so many ways. I mean, first of all, forgetting about the type of cancer, any sort of cancer diagnosis, whether it's within the, you know, couple themselves or within the family for a parent, a child, right? The stress of dealing
Yes.
with that and getting
Yeah,
that diagnosis, what that does to someone's libido. I mean, the last thing you're thinking about when you're dealing with a
absolutely.
stressful information like this
Mhm.
is sexual intercourse. And then there's also the physical ramifications of having cancer. Oftentimes, there's surgery involved. Sometimes the surgery can affect some of the sexual organs, like breast cancer. You may need to undergo a mastectomy, and how that makes a woman feel losing that part of her body. Even having a hysterectomy or having the ovaries removed, certain types of vaginal cancers, vulvar carcinoma. Again, there's more outward manifestations of that affect our sexual sense of self. And like you said, for men, prostate cancer, very often the treatments we use for prostate cancer, whether it's surgery or radiation or even hormonal therapies, can affect a man's ability to have an erection, or even affect a man's ability to maintain urinary continence, which again, it's another thing that can cause people to lose their sense of self and their sexual well-being.
Right, right. Yes, no, you are so right about everything in terms of, just a diagnosis of cancer, inducing stress. And we know stress affects so many aspects of our life and of our body, and just the cortisol, and then resulting in, if we are under constant stress, then it results in adrenal fatigue and just the negative feedback that we know happens when you have constant release of cortisol and those hormones. And also, of course, when people undergo um, surgical treatment for their cancers, and how that affects intimacy and relationships. But what I find is that, along with, of course, not only body image being affected, and also different organs not, or body parts not performing the way that a person may want them to perform, is also that emotional connection. Right, oftentimes patients may feel isolated, and you would know that better than I would know. But I'm sure that patients feel isolated, and maybe they don't feel understood by their partner, and then they themselves undergo body image issues. Maybe they don't feel like they're attractive anymore. Maybe they have some type of body dysmorphic syndrome, right, where they find themselves to be not attractive, or just not as human as somebody else that doesn't have that cancer. So I'm sure that plays a huge part in relationships. How have you counseled patients in the past that maybe finding it very difficult to resume any type of intimacy, regardless, whether it's physical or not, emotional, intellectual, experiential type of intimacy with their partner. What have you seen and what have you suggested in the past?
Um, well, I think, sometimes it's a matter of finding a new normal.
Yeah.
People may not be able to do the things they used to do, but there's still ways you can be sexually intimate with someone. It just may not be the way you used to. And the other thing is also being creative. Some of the treatments we use for cancers involve hormonal therapies that can cause a lot of vaginal dryness and discomfort with
Mm.
sexual intercourse. And I've heard anything from olive oil to coconut oil, and obviously the more traditional lubricants. But finding ways to obviously relieve those symptoms, and reduce any pain associated with intercourse is important.
Absolutely. I know that recently, so, there's a whole generation of OBGYNs that just do not feel comfortable prescribing hormone replacement therapy. And I think that has a lot to do with the WHI study that came out in 2001, which, based on what it was doing and what it was trying to cover, I think there was a lot of confusion during that time. And some of the information that came out of it was, quite frankly, not correct. And I think that the North American Menopause Society has now come out with new guidelines stating, who can go on hormone therapy and who should not. And also, I think the recommendation now from that Menopause Society is that women can go on hormone therapy for the least amount of time to take care of their symptoms. And of course, they have to talk to their oncologist, and we have to know if it's, estrogen receptor positive and all of those things. So it's obviously not something that women would do on their own, but something in conjunction with their hematologist as well as their oncologist and their gynecologist. But recent studies have come out and have shown that with local vaginal estrogen, right, most women can actually have that, and that there is very little systemic. So for people that are listening that may not understand what that means, it means that there's very little hormone that goes throughout the rest of the body, and that it's a very tiny dose of estrogen that acts locally within that vaginal tissue. And even that little amount actually is enough to help keep that tissue vitality alive and also prevent recurrent UTIs. And I think that there is a huge arsenal of physicians now coming out, both urologists and gynecologists. And recently, I also heard of a breast surgeon saying the same thing, that the use of vaginal estrogen is actually safe. For women, and that it makes such a huge difference in terms of intimacy, but even in terms of preventing recurrent UTIs and for that vaginal health. So I don't know if you've heard of similar things, but I know that there's a lot of research coming out in regard to that.
Yes, yes, absolutely. We, traditionally were always concerned in a woman who had a history of an estrogen receptor positive cancer about putting them on hormone replacement therapy. But as you said, it has been looked at, and studies have shown that low dose topical estrogen, whether it's with an estrogen containing vaginal cream or the S string, which is a ring that releases estrogen into the vaginal area, seems to be safe for these women. So that's reassuring. Of course, we always usually try first to do non hormone containing remedies, but if they don't work, and um, oftentimes they don't work, then we do feel comfortable using an estrogen based therapy.
Right. And just like what you said, most of the time we know that like lubricants are very temporary, right? They don't last very long. I mean, there's tons of lubricants and there are different types. There's like what you had mentioned, there's that vegetable oil that people like to use, which is the coconut oil, or, but there's, oil, there are water based, there's silicone based, there's different types of lubricants, and those lubricants are great, but of course they're, temporary. Moisturizers are good as well. And like you said, there's something called Intra Rosa, which is that DHEA vaginal moisturizer that actually is good for people that may not feel comfortable with estrogen and so want something else. And so DHEA is great for that. And DHEA actually converts to testosterone as well. And so then some women feel that it actually helps a little bit with libido. Um, but yeah, I mean, I think that really, if we're going to talk about something that really works and works really well, is that vaginal estrogen. And so that it helps with the tissue, and so that there is less friction when, women decide if they want to have the vaginal intercourse, and it really is helpful for them. But like you said, a lot of times we'll go with lubricants first. Um, so, is there anything that you would recommend to somebody? I know you had talked a little bit about it already, but for somebody, like 3 take-home tips that you may recommend to somebody that, once they get, what should they do? Once they get that diagnosis, and, should they go and seek you out first? Should they go and talk to their provider? How should they, maybe what is like an algorithm or something that you would recommend, a stepwise process, I guess, is what I'm looking
Right. Well, I think, most importantly, you want to find an oncologist who you feel comfortable with. Okay, because you may even be with the person that is top of their field, they have a great reputation, but if you don't feel like you can ask them questions, get your questions answered, and feel comfortable in their office, is the office staff accommodating and nice, or is it a nightmare every time you go there? Because very often your relationship with your oncologist is going to be one that's long-standing and where you're
right.
going to have to go a lot. So you really have to feel comfortable with that person. So I would say go with your gut. And if there's something about a doctor that just doesn't feel right, you don't have confidence in them, you don't feel comfortable asking questions in their office, then you may want to think about seeking someone else out.
Right.
The other thing I would say is educate yourself, understand your diagnosis. If you are starting any treatments, understand what's the purpose of this treatment. Is my cancer curable? Are we trying to cure this? Or is it more advanced and we're just trying to relieve my symptoms or make me live longer? Really understand what's happening. Um, and then the third thing I would say is don't be afraid to seek support. You are
Mm,
not alone, even if you feel alone. And sometimes people may have a very supportive family that's there for them, and they're not necessarily alone, but they feel isolated because
mm,
nobody understands what they're going through. And there's really great support services out there. There's the cancer support community, which has sites all over the United States and even internationally. Gilda's Club,
mm.
which again has multiple sites. And in most places there's some form of support, and even online now, everything's virtual. Find a support group, find people going through what you're going through, because that can really help.
Absolutely. Absolutely. I think those are great recommendations. If I could just add one thing is I would say don't be afraid to ask your doctor questions, right? And even if they're not able to answer it, hopefully they can find somewhere where they can find the answer, or maybe they can refer you to somebody that does have the answer. I think a lot of times what happens is that, especially when it comes to sexual health, is that patients, one, are not asked about it, right? A lot of times they'll go into the doctor's office and the doctor will ask them about everything except that. And when patients have a diagnosis of cancer, that's one of the first things to kind of go by the wayside, right? And physicians don't, a lot of times physicians don't even feel comfortable asking because they don't know the answers and they don't know how to help their patients. Because I'm not sure about what you learned, but I know what I learned in medical school. I didn't learn anything about sexual health. I learned maybe, 2 hours worth about like Masters and Johnson and the research that they did in like 1966 on old white men. That was it. And there's been, a little bit of research since then. So, um, I think that most physicians don't have the knowledge and don't really feel comfortable talking about sex and asking about sexual history and asking about, especially with a diagnosis such as cancer, right? Like, how are you feeling? How is your relationship? Is there anything that you wish would change? Is there anything that you want? Right? Or do you need help with something? I think that those are a lot of times questions that we're afraid to ask. And I think a lot of practitioners don't know how to treat menopause. And again, being an OBGYN, I was not trained in my residency. And I don't know if things have changed. I don't think they have because I recently worked at an academic institution. The residents just don't learn how to treat menopause. We don't learn the modalities. We don't know anything about hormone replacement. Because of the WHI study, a whole generation of OBGYNs were so scared, including myself, to prescribe any type of hormone replacement that we just never did. And so for years and years, women have gone through, hot flashes, night sweats, mood swings, brain fog, all of that stuff, palpitations without any type of treatment and thinking that there was nothing out there for us. So I think it just behooves us as the medical community to let women know that there are options. And if they need help, to seek help. So, yeah.
Absolutely. Absolutely. And the only other thing I want to add is be careful about what you read online because there's just so much out there now. And, particularly with cancer, it can sound scary. And again, not everybody's cancer is the same. So you may read what helped one person may not apply in your situation. So you really need to rely on your physicians to guide you. So you want to have a good relationship with your physicians. And for, patients that have difficulty getting the support they need from their physicians, that's where I can come in and be there for them.
Absolutely. And I think it's so important the service that you offer because as we know, anyone that has had a loved one that had cancer or has cancer, it's so important to be able to kind of ask questions of another physician, another hematologist, oncologist, and ask them one, if you feel like your loved one is getting the correct treatment and if you have any concerns or if you feel like there may be other options that maybe your oncologist doesn't know of, right? And I think you help with that as well. So for people out there that are listening that may be interested in reaching out to you, how can they get in touch with you?
Sure. Well, they can email me at jmonroe, JMONROE, MD at Cancer Consulting Services with an S.com, or they can go to my website, www.cancerconsultingservices.com.
Okay, awesome. And are you on social media? Is there any way that they can follow you? Are you on Twitter?
I'm just on Facebook right now, but
Okay.
working on getting TikTok up and running.
Oh, that would be awesome. Well, we're looking forward to it. But thank you so much for coming on and sharing with us your pearls about cancer and how to navigate that diagnosis and why it's so important to have somebody in your corner rooting for you and helping you navigate the whole process. So I think that's really amazing what you do. So thank you so much for doing that.
Great to talk with you. Thanks for having me.
Yeah. So, and well, I am done here and it's been real and really intimate. So, remember, this was not meant to be any type of medical advice. So, if you are having any concerns or if you have any questions about your own medical health, please reach out to your provider and seek help that way. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.